just came back from the doctor and he prescribed a medication to your child. Very often we find that parents did not really understand what to do, and that can lead to a lot of mishaps that you should know about. So we created what we call the 10 commandments of giving a medication to a child, and I'll go through it briefly. It all makes a lot of sense, but we don't use it always. The first is, what's the name of the drug? Everything is in the name. Often you may misspell a name and get a totally different drug. One example, there's a drug for morning sickness called diclectin, and there's a drug for epilepsy called dilantin. And we see a lot of times sound alike, leading to a lot of problems. So be sure, what's the name? What's the medication for? You need to know why you give a medication. Your literacy, your understanding of what you give is key for a child getting what he needs or she needs. How to give it? It may sound foolish, but not everything is given orally. Maybe the most terrible example I have in mind as a toxicologist is when mom wants to rub camphor oil into the chest of a child. She instructed dad when she went to work to do it, and he gave it to the child in a teaspoon to have seizures and life-threatening events. So be sure that you understand how to give the drug. Is the dose you're receiving for your child typical, or is it relatively high? Because you need to know what to expect if the dose is high. How quickly it will work. If it's for fever, if it's an antibiotic, you want to know how quickly to expect a response. Because if you expect too fast, it will not happen, and you will be disappointed and maybe run back to see what's going on. You really want to know what common side effects of the drugs, what to expect. From allergy to anything else, diarrhea, ask about it. It's all in the product monograph, but you should ask specifically these questions and you will get an answer. What are serious side effects? Maybe generally the serious side effects are rare, but you need to know about them, because if it happens you may think it's a new illness, where it's in fact a result of a drug that you gave your child to improve his or her situation. What are the alternatives? If the drug does not work, or if the drug has side effects that you are concerned about, what else can be given to a child? You should ask that question. If your child is known to be allergic to anything, you have to mention it, because the drug name may not suggest to you it's a sulfa, but it may be a sulfa under another name. You have to bring it up. The doctor may not be able to tell just by your chart or by event that you went to hospital. Most importantly, or not often known to parents, when there is a change in a drug, your child is on a chronic medication and now they change from a syrup to a tablet or increasing the dose. A lot of time there are mishaps because you did not necessarily understood what was said. These are all look simple, but if you follow them, it may make a big difference, and in times may save lives.